Good day, ladies and gentlemen. Thank you for being here today. By the way, I am Carol May Labiano, a second-year student from Tagalwan Community College. I am here to talk to you what current situation, not just in our country, but in whole world. It is about COVID-19. So COVID-19 is one of the humanitarian crises nowadays. So as we can see, COVID-19 pandemic continues to take a heavy toll on families, communities, and nations the world over. But it's also giving rise to incredible acts of generosity, solidarity, and cooperation. We have said consistently that we're all in this together and we can only succeed together. We need an all-of-society approach with everyone playing their part. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the decreasing number of cases, the number of deaths, and the number of affected countries. COVID-19 can be characterized as a pandemic. Do we all know what pandemic is? So pandemic is not a word to use lightly or carelessly. It is a word that if misused can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Pandemic is an outbreak of a disease that spread worldwide and affects high proportion of the population. We have never seen before a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never seen before a pandemic that can be controlled at the same time. We are all called every day to take urgent and aggressive action. We have rang the alarm bell loud and clear. Just by looking at the number of cases and the number of countries affected does not tell the full story. We cannot say this is loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. Several countries have demonstrated that this virus can be supposed and controlled. The challenge for many countries who are now dealing with large clusters or community transmission is not whether they can do the same, it's whether they will. Some countries are struggling with a lack of capacity. Some countries are struggling with lack of resources. Some countries are struggling with a lack of resolve. We are grateful for the measures being taken in our countries to slow the virus and control the epidemics. We know that these measures are taking a heavy toll on societies and economy. All of us must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. All of us must take a whole of government, whole of society approach built around a comprehensive strategy to prevent infection, save lives, and minimize impact. Let me summarize it in 4 key areas. First, prepare and be ready. Second, detect, protect, and treat. Third, reduce transmission. And lastly, innovate and learn. I just want to remind all of us to active and scale up our emergency response mechanisms. Communicate with other people about the risk and how they can protect themselves. This is everybody's business. Let me give you some other words that matter much more that are much more actionable, like prevention, preparedness, public health, and most of all, people. It will all be possible to end the misery if all of us, every one of us, will support, obey, and have unity for our beloved Pearl of the Orient. But most of all, we should have strong faith and connection to our beloved God. Humanitarian crisis indeed had a worldwide effect. If we want change, start with ourselves. According to the famous educator, the most permanent thing in the world is change. Therefore, to be or not to be, that is the question. Thank you and God